Hey guys, what's going on? I want to thank you all for joining for another episode of Talking with Jess. Let's get right into it, man. Go ahead and hit that like button, hit that subscribe button, hit that share button because you know what it is. It is your host with the most, the villain with the vocabulary, the mad hatter behind the microphone, the blaster with the bastard, excuse me, the bastard with a black t-shirt, Louisiana born and raised, North Carolina adopted, Houston, Texas living, the best from east to west. That's it. Jess Jess. Now let's jump right into it, man. So I came across a story, man, that I found very interesting, very sad, actually. Coming out of New York City, man, and people can put all the clean names on it that they want to. To me, this is a legalized trap house. You know, in a moment, I'm going to play the video for you in its entirety as to where there is they call them get clean homes or drug control centers, as to where people can go and legally use drugs, bring their own needles to make sure they're clean, or use the facilities needles to make sure they're clean and shoot up. And with the prevention of having an overdose or the option to get clean. And the chilling story behind this is that it's right across from a school in Harlem. Don't take my word for it. Watch this video in its entirety.
Let me show you the area here in East Harlem. The site that we're talking about is right across the street from a school that you see here. And just across the way, there are people waiting outside to get into this clinic.
You can get high without the chance of killing yourself.
Calvin Russell is a participant of the nation's first Overdose Prevention Center. In this facility, users bring their own drugs to shoot up while supervised by trained staff with clean needles, medication to reverse an overdose, or the option to get clean.
I get the needles here, clean needles. I get the smoking pipe here. I wash my clothes here. I said caseworker here.
These sites are evidence-based.
Kaylin C. is a senior director running the center, which she says is in response to a drug epidemic.
This is actually a response to what the community has asked for. The community has asked for less public drug use, less discarded syringes, less overdose occurrence, less overdose death, and these sites will accomplish those goals.
More than 2,000 people died of drug overdoses in New York City in 2020, which is the highest over the last 2 decades.
It's been really hard on the staff and the participants over the years to lose so many people unnecessarily. And I just think that we think of them and we remember them when we opened our doors this morning, all of the people who didn't make it.
Manhattan has 2 centers in East Harlem and Washington Heights. The city's health committee chair says this will improve the quality of life in these neighborhoods and reduce public drug use.
We have a crisis in which every 4 hours, someone in New York City dies from overdose. So our top priority is addressing that and reducing fatalities. And this is a strategy which has done that successfully around the world.
But there is a debate of the morality and legality of attracting drug users to the neighborhood. Republican Congresswoman Nicole Malliotakis from Staten Island sent this letter to the U.S. Attorney General asking the Department of Justice to put a stop to these injection sites.
We need to fight this issue at the core of the problem, which is where are the dealers coming from and where are the drugs coming from? And we know the answers, but the city and the state are not taking action to resolve this, and neither is the federal government.
Meanwhile, Manhattan District Attorney Cy Vance says he's proud New York City will have the first overdose prevention center in the country and will not be taking enforcement action. Manhattan Borough President-elect, also the city's health committee chair, Mark Levine, is hoping that these sites actually spread to each borough across the city.
So we clearly saw the same video. And I have a question as to what city and state official allowed this to be passed. What city councilman saw this on his desk and thought this would be a marvelous idea? Not a rehab facility. There's the option to get clean, but there's actually a facility where you go in and use clean needles so you can get high safely. You can use the drug in moderation or in a safe space or safe environment. And then it's right across from the school. That's the chilling part. Could you imagine, a kid's classmates seeing their parents, in line to go to the trap house, so to speak, the legal trap house? It's enough that kids pick and roast each other. Like, you know what? Prime example. Could you imagine this being back in the day, doing a roast session, like if there was social media back then and somebody was actually recording somebody's mom or dad going inside the safe trap house? Yeah, man, and posting it on social media or bringing it back to the classroom to show everybody what's on camera. I mean, come on, man. Like, we got to do better. I didn't see, news outlets about new libraries populating, new recreation centers, new boxing gyms, new martial arts dojos, but a trap house, essentially what it is, a safe trap house. Who comes up with this? Like, really? What is the benefit for the community? What is the benefit for that individual? There really is none, because they made it known that there's an option to get clean there. They won't, there's the option, but will have that same addiction that you waltzed in here with at your disposal. I don't get it, man. I really don't get it. I remember going to school, we had DARE programs with a goofy little lion that would tell you, say no to drugs, along with Scruff McGruff and whatever his name was. But now it's almost like, well, we can't help you because we kind of realize that this war on drugs that we started is kind of taking over. So we'll help you get through this safely. Kind of reminds me of this meme they have of Jack Nicholson's The Joker when he says, "Those that sell the panic also sell the pill." This is weird, man. I never seen nothing like it before in my life. Like, it's a safe trap house. And I can only imagine where we're going to be in the next 5 or 10 years from here. It's not looking really good. So you guys saw the same video that I saw. Let me know what you think in the comment section. Use that hashtag Talking with Jess. Take care of yourselves. Stay safe out there. Excellence, no excuses.